Welcome to a special episode of Sitting with Shay J, dedicated to Black Maternal Health Week. This is observed April 11th through the 17th, and today we're shining a spotlight on the critical importance of prioritizing Black maternal health and empowering Black birthing individuals. Joining me today is our special guest, Ashley Character, owner and midwife of Birthing Characters, to discuss this very urgent need. Thank you so much, Ashley.
Thank you for having me, Shay.
Absolutely. When we think about access and advocating, I really want to dive into this conversation, kick off things by, can you share the significance of Black Maternal Health Week and why it's essential that we raise awareness?
Well, it's really important because in our country, we are facing a maternal mortality, morbidity crisis. So our Black birthing individuals are at a significantly increased risk for death and complications in pregnancy and the immediate childbearing period. So in that first 12 months after the baby's born. And if we don't talk about this, we can't increase accessibility, we can't improve outcomes to all of our birthing families without addressing this issue.
This is so critical. I'm excited to have this conversation because I know how necessary it is. As the owner and midwife of Birthing Characters, you are deeply involved in really supporting Black birthing individuals. Can you tell me maybe about the importance of the journey and what inspired you really to take this on as a career and what I look at as a big cause, actually?
Well, so when I was young, my dad would actually make me watch my birth as a child.
Oh. Wow.
And as a child, I thought it was really uncomfortable and weird.
Yeah.
As I started to mature, I realized that, wow, it's so powerful to see the first moment that you're separated from your mother and to see that this is the person that actually is giving you life. And so I really began to enjoy and looked forward to that moment with my family of like watching my first breaths, right? So I thought I wanted to be an OBGYN naturally because that's who helps babies into the world. And then when I was looking into going to school, I was like, realistically, I don't want to go to school for 10 years to be a surgeon. I just want to help bring babies into the world. And so that's when midwifery was exposed to me. And as I dove deeper into the what that career path looked like, I learned about different types of midwives. And essentially decided I didn't know if I wanted to work in hospitals or at home or in birth centers, but I wanted to be a midwife. I wanted to help babies into the world. And so I became a nurse midwife. And it was really through learning what that path would look like that I learned of these health disparities that exist in our country. And for us to be a developed nation, we are among the worst in health outcomes for Black birthing people. So I knew I wanted to be a part of that change. And it's taken me down a road that I did not know I would lead to. But I am so grateful for my journey. And most recently, just a year ago, I had my own home birth experience and was exposed to the intimacies of the relationship of having a baby at home and the intimacy of that and the bonds that I formed with my midwife. It's just indescribable.
Wow, I don't think we ever think about all the different ways that we can actually bring life into this world and the options that we have. And with disparities, I think this access is absolutely necessary to have that conversation. When we look at some of the counterparts, what do you think some of the root causes are behind the disparities that we see that are impacting Black birthing individuals? What may be some of that problems, why these disparities are happening?
Yeah, I mean, when we look at the statistics, when we look at the evidence, it says that women are not being heard. Black women specifically are not being heard. So if I report to you, I'm having so much more swelling than I was, it's brushed off. You're not drinking enough water. If I tell you, I'm having so much pain here, it's brushed off as, well, what is your, let's give you Tylenol.
Right.
Or maybe you're not resting enough. These concerns that could actually be really clear symptoms of things that are happening within your body, they're not listened to and they're not explored. And so these things that could be caught early are just ignored. And the biggest issue is that there's a lack of representation for Black women. Yeah. As a Black birthing individual, when I realized I was pregnant and I wanted someone that looked like me. And unfortunately in Colorado, I didn't have a lot of options.
Absolutely.
So that was really a leading factor in knowing the environment and knowing the landscape of birth here in Denver. That was why I chose the route that I did. Was I knew I was a normal, healthy person. I wanted a normal, healthy experience. I wanted to be supported and heard, and make it out alive. You know, to care for my girls, and I knew that the only way to guarantee that was to have someone that looked like me that could hear me.
No, I think you're going to inspire so many Black birthing individuals that are at home. When I think about empowerment, I feel like it's the central theme in your work and what you're really doing. How do you really empower Black birthing individuals to understand how to advocate for their own health, how to be taken seriously, and like what their well-being looks like throughout the process? How does that work?
Yeah, and so as a midwife, I think that's why midwifery care is so important, is it allows an opportunity for time to be spent. In these hospital systems, you are scheduled at every 15 or 20-minute increments. By the time the medical assistant does your blood pressure and checks you in and does all those things, you get maybe 6 minutes with your provider. And in that 6 minutes, that provider is supposed to listen to your baby, make sure your baby's measuring appropriately, feel the position your baby's in, and also address any concerns that you have.
Yeah.
It's just
it's
unrealistic.
A lot in 6 minutes.
Yeah. It's unrealistic expectations.
Right.
And then with midwifery care, in the out-of-hospital setting, I'm able to spend 45 minutes to an hour with each person to address all of the concerns that you have, answering your questions, providing education, telling you what to expect and what's going to come in the next few weeks, talking to you about the normalcies of what is uncomfortable in pregnancy and what is not normal, giving you resources to educate yourself to make the decisions that you can. We also talk a lot about your support system, because we ignore the impact and the significance of your support system. And it is so valuable. When we look back at when we were having babies before we came to this country, it was a village that was taking care of us. I wasn't birthing my baby and then the next 12 hours making a meal for my family.
Oh, that's huge.
Yeah. And so just really leaning into the community that you have and really reiterating the significance and the importance of that so that you allow your body to heal and recover. Pregnancy, I always say, pregnancy is a marathon, and the labor and birth experience is not the end. It's really just the beginning of another segment of that marathon.
Wow, because we sometimes think like, this is the final spot.
No, it's
Once
not.
I have the baby, I've done the work, but there's so much more that comes with it. Really addressing systematic issues in the maternal health care. It requires collective action, advocacy. How do you engage with the broader community to really raise awareness and drive some positive change in the Black maternal health and really the outcomes of what that looks like?
I think that the biggest piece is having these conversations.
Yeah.
You can't expect everyone to know everything. And so I take the lens of, if I don't have these conversations, I can't address the issue. And so in every environment, it's no secret that I'm a Black midwife.
Yeah.
My job and my goal is to serve Black birthing people. And so I am, really essential to addressing this. And I challenge those people around me. Either you're an ally or you're not. Is essentially how it's put. And if you don't want to be an ally, then you shouldn't be in this work. And it's everyone's responsibility. Some evidence says that the support people are the ones that should advocate for the birthing person, but it can't just be them. It has to be the system where systemic racism happens. And so that's in hospital policies, that's in hospital procedures, that's in the literature, right? We have to be representative in all of those places for it to be reflected. The biggest gap that we see is in the education that doctors are getting and the education that midwives are getting. And so how do we penetrate those systems to infiltrate and to produce the change that we expect to see. You have to have the conversations. And sometimes they're uncomfortable.
Right.
But
we
that's
have
what
to
leads to change.
That's what leads to change. This is what I thought about when I said, why do I want to have Sitting with Shay J? It's because we have to be having these impactful conversations that actually move needles forward in our community. And there are things that our community needs to know. Ashley, as we begin to wrap up, what messages or call to actions would you like to leave for our audience that is in the importance of this conversation regarding support, regarding Black maternal health? What do you want to leave with them for these individuals that may be new to this conversation or maybe at home saying, I didn't even know these options were available? What, call to action can we put out there?
Yeah, I think that the biggest thing that you can do is ask your provider what your options are. The biggest misconception is that people are high risk. They're labeled high risk, and there's a level of ignorance that exists because they just assume that they're high risk because their OB has said it, and the OB has said they're high risk because they also don't know what risks people out of home birth or community or birth center birth. And so ask your provider, is this my only option for birthing? How are you supporting me as a Black birthing individual? How are you reducing my risk for maternal morbidity and mortality? And when you ask those questions, one, if your provider or your support person doesn't have an answer for you, that is an answer.
Wow.
And if they do have resources for you, I encourage you to explore those options because you don't know what options are available for you until you really ask those questions.
I am inspired for sure. So I hope that you at home were taking notes and you're passing this information on to someone else. As we come to the end of this episode, I want to extend a heartfelt thank you to you, Ashley Character, really for giving us some expertise and passion for empowering Black birthing individuals out there. Ashley, your dedication to addressing maternal health outcomes is truly inspiring. I think that we need to be having conversations more like this. So to our viewers, thank you for tuning in and joining us and helping us raise awareness about this important issue. Remember, this fight for equitable healthcare and access continues, but we have to do it together in order to make a difference. So please stay informed, stay engaged, and let's work towards a future where every birthing person receives the care and support they deserve. Until next time, let's make sure we take care, stay empowered, and keep watching Sitting with Shay J, where we explore impact and inspire change.